speak. They won't hear me, but continue.
Yeah, that was good. Sorry. Good evening, everyone, and welcome to the evening. We have come to answer a few questions that have been asked by quite a number. So we'll for the next few minutes, we will be answering some questions that are pertinent mainly to reproductive health, the female reproductive health mainly. We come from an organization. We are speaking from the platform of an organization called She Chooses to Live Initiative, which is an non-governmental organization that is aiming at specifically giving women knowledge so that they live holistic lives, especially where reproductive health is concerned. We've come to realize that the knowledge about reproductive health in our setup is very, very little. And we'd want to add to that and to make women understand that it is possible to make some choices and live with better consequences than making some other choices. So She Chooses to Live initiative is all about giving both men and women knowledge so that women can be assisted to live real whole lives where reproductive health is concerned. So this session we are going to answer some questions that have been frequently asked by some people. My name is Dr. Jane Wakahe. I am an obstetrician gynecologist by profession. I've been practicing for many years. And to my left here is my tech guy. She's called Marion Wakahe. She is responsible for putting me on screen and removing me from screen. All I do is talk. So yeah, she'll ask the questions, and then I'll answer the questions. And if you have questions along the line, you can ask, and we shall be able to answer them. We'll take just a few minutes, not a long session, then we answer the questions that we now have. So tech guy can start asking the questions.
Okay. The first question is secondary dysmenorrhea totally curable?
Now, I believe we've spoken about dysmenorrhea, and there is primary or spasmodic, and there is secondary or congestive dysmenorrhea. The primary one is usually caused by just a tightness of the cervix, and usually when the cervix becomes looser, then the dysmenorrhea goes. But the secondary dysmenorrhea is caused by many other issues. It could be an infection in the pelvis. It could be something like adenomyosis, endometriosis. It could be things like fibroids. It could be adhesions from previous surgeries, or adhesions means things, organs in the pelvis matting together and holding and pulling each other around. That's what adhesions do. So it could be many things, and it is not possible to answer that secondary dysmenorrhea can be totally cured, because you'd have to cure the cause of the secondary dysmenorrhea. But primary dysmenorrhea in about 80% of women, when they become pregnant, they usually thereafter the dysmenorrhea usually goes. But secondary you'd have to cure totally whatever is the cause of the secondary dysmenorrhea, and then then it will be cured. But that's very unusual. Yeah.
All right. Is it normal to receive my periods twice a month?
It depends on what one means twice a month. A normal period, the length of a normal period from start to start is between 21 days and 35 days. So you can receive your period on the 1st of February and receive again on the 22nd of February, and that would be normal. Or you can receive on the 1st of February and receive again on about the 6th of March, and that would still be normal. So it depends on what one means by twice a month. As long as it's more than 21 days apart from start to start, then yes, that is acceptable. That is still within normal limits. However, if somebody has been getting, say, 30 days, and then suddenly they start getting 21, then they need to get checked by the doctor to see why the cycle has suddenly changed, or if the bleeding is of physiological nature or abnormal pathological nature. So it needs that if you've been having your period twice a month as a routine, that's okay, as long as it's usually more than 21 days apart. But if there's a change, then see your doctor.
All right. I have vaginal discharge that has not cleared even after visiting the doctor. My discharge is milky and smelly during intercourse.
A woman always has discharge, and during intercourse, because of the mixture of one's hormones and discharge and the semen, there is always some sort of smell. However, it shouldn't be a foul smell, it shouldn't be a bad smell. I'm not sure what they have done to check what is the cause of your discharge. I would suggest that you get what is called a high vaginal swab to check for what is causing that if there is an infection. And as one does high vaginal swab, you have to specifically also ask for something called chlamydia, because chlamydia is not easily picked just by high vaginal swab. So you'd have to ask for chlamydia, for gonorrhea, and for any other infection. But you need the high vaginal swab, and you need specifically to ask for chlamydia infection checkup. Then check if there is something, any infection that is found in the discharge, then you get treatment. Sometimes it's very difficult to diagnose chlamydia, so it needs specifically tell the laboratory that you're checking for chlamydia.
I have tried to conceive for the past 5 years to no avail. I have been told I have beaded fallopian tubes. Please advice on what I can take or do for my problem.
5 years is a long time not to conceive. Actually, if you're having normal sexual intercourse, that is about 3 times in a week scattered over the week. If you're having that kind of sexual intercourse and everything is fine, you should conceive within about a year. So 5 years is a long time. Now I'm going to assume that beaded fallopian tubes means blocked fallopian tubes, because then maybe they are blocked in bits, and hence you are told beaded. But I'm going to assume it's blocked fallopian tubes. If it is blocked fallopian tubes, it used to be that we would try surgery a few years back. We would try surgery and see if we can open the fallopian tubes. But of late, technology has come where it is possible to do what is called in vitro fertilization. What it means is that fallopian tubes, if they are blocked, then there is no access of sperm to the egg. They never really meet, because they usually meet in the fallopian tube, and fertilization happens there. So if they are blocked, then the sperm cannot meet the egg, so fertilization cannot happen. So what happens in vitro is that the egg is harvested out of the woman's body, and it is fertilized out of the woman's body, and then it is put into the uterus now to grow. So these days there is that option of in vitro fertilization. However, your doctor would advise you whether the way your fallopian tubes are, whether it is worth trying surgery or not. Sometimes it is, sometimes it isn't. It depends mainly on how badly blocked the tubes are and at what point of the length of the tube the blockage has happened. So yes, you'd have to listen to your doctor and you can also consider the issue of IVF.
Can having beards on women affect the reproductive system? When I began my menses, they were irregular, receiving maybe once or twice a year. My menses are now normal, but I'm still unable to conceive after 13 years of marriage. I also want to know if there's a permanent way of removing beards.
We all are manufactured male and female, in the sense that we all have women have female hormones as a bigger component, but we also have the male hormone. In fact, that's why you find that when a woman grows old, she looks more like a man, because her female hormone has gone down, but her male hormone hasn't gone down. And the same happens to men. When they grow old, they stop being so manly and become a bit feminine. So we are all manufactured with the male hormone and the female hormone, and some of the women have a bit more of the male hormone than usual, and that would lead to hairiness and the beard. Having said that, there's quite a number of women with beard, and they are able to reproduce with no issues. But having said that, if you combine the beard with the irregularity of periods, now that begs for another situation, and most likely what it has been is that maybe, this is a maybe, and you need to go to your doctor to get checked properly for it. It may be that there is what is called polycystic ovarian syndrome, which means that the eggs are not being released to be able to either get fertilized, and that they are not being released regularly enough to give you a period. And these people with polycystic ovarian syndrome also tend to get a bit more male hormone than their other female counterparts. So get your hormonal analysis done as to why the periods are irregular, as to why the irregular periods would explain also the lack of conception, because then irregular periods almost mean that you're not ovulating. If an egg is coming out every month, then you get a regular period ranging, like I said, between 21 days and 35 days. If that is happening every 35 days or between 21 and 35 days, it means the eggs are being released. But if it's going beyond 35 days, like you can go 2-3 months without a period, that means that unless you are using some sort of contraception, or unless it's soon after delivery, if it is a natural, normal time, then that means that the eggs are not getting released regularly, in which case one needs to be checked by the doctor. So 13 years is a long time. Get yourself checked up, and like I said, remember that conception takes 2 people. So even as you are being checked, have you got polycystic ovaries? Are your hormones imbalanced? There is also need to check your partner, that they are able to give you sperm, because even people with polycystic ovaries, there are times that they will ovulate in a natural way and get pregnant. So it's not that it is totally impossible to get pregnant even with polycystic ovaries. So yours is a combination that is a bit complex. It needs real workup by the doctor to determine what the issue is.
If my cycle is 30 days, will I ovulate on the 13th day?
The answer to that is that you could, yes, you could. The ovulation happens 14 days before the next period. So if you are a 30-day cycle person, 14 days before your next period is day 16. So the kind of real time that majority of 30-day people will ovulate is day 16. But there is plus or minus 2 days, since a woman is really not a computer. So you can ovulate 2 days earlier, or 1 day earlier, or on day 16, or on day 17, or day 18. So that range is acceptable. So yes, you could ovulate on day 14, day 15, day 16, day 17, day 18. Yes, you could. But the time to time, if you are a 30-day person, is day 16.
Okay. I had a baby 3 months ago. I'm still experiencing a yellow discharge and pain on the stitches, especially when I stand up. I tried getting intimate with my partner at 9 weeks, but I started bleeding. Tried again at 12 weeks, but still experienced pain. How can I manage my situation?
When one delivers, there's something called lochia loss, and it starts off as red blood. It moves to brownish, it moves to pinkish, and finally goes to a yellow discharge. And a lot of people think they have an infection because the discharge is yellowish. But this discharge should be gone by week 6, because that's the time of what we call puerperium. That's the time when the pregnancy state finishes. So if you're getting this discharge after 6 weeks, then there is something wrong. One of the things that could be wrong is infection, and because the uterus, usually where the baby comes from, is quite raw, it can be infected and you can be having a yellowish discharge. I think you've said about stitches, how they are also not healed, so that could also be a sign of an infection. So it is wrong, it is always wrong to bleed when you have sex. So it could be anything from infection, it could be anything to do with your cervix, it could be anything in the vaginal canal. So please quickly go and consult your doctor and see what it is, that they give you a thorough checkup and maybe some investigations and decide what the problem is. You should not be having any abnormal discharge after week 6 after delivery. Whether it is a normal delivery or a cesarean section delivery, 6 weeks is the end of puerperium. You become normal again at that time. There should be no discharge concerned with pregnancy.
I visited a gynecologist and was told I have HPV. I also have warts on my vagina. What can I do to get rid of the warts?
HPV stands for human papilloma virus. There are at least 200 types of human papilloma virus, and they are the causes of things like vulvar warts. So human papilloma virus, you can get warts, and if they grow, it depends on what size of warts it is. At the very beginning, there is a way one can be given an antiviral cream, because warts are viral, and if applied long enough, they can shrink. If they are too big, then they will need to be done what is called cauterization, which means that you are taken to theater and they are literally burnt off. Otherwise, there is no other way of getting rid of warts once they start growing. They also show that your immunity is a bit down, and sometimes they will grow very fast when you're pregnant, because your immunity then also goes down. And like if you're pregnant and you have big warts there, then you would have to deliver by cesarean section to try to avoid infecting the baby. Now that's the human papilloma virus that causes warts. But there's the other human papilloma virus that is not visible. It doesn't cause visible problems until such a time as it changes the cervix towards cancer. And that is the human papilloma virus that is even more scary, because it is a very quiet something. You don't know it is there. and if it persists, in some people it changes the cervix towards cancer of the cervix. So if you have human papillomavirus, if you have warts, then you need to have yourself checked for what is called the high risk human papillomavirus. High risk human papillomavirus are the 6 subtypes, the 6 types that are responsible for causing cancer of the cervix. So you need a checkup to find out whether you have any of those. If those are present, then you need to be very, very vigilant about checking your cervix, making sure that it's not changing into cancer, and if it is changing into cancer, then it is caught early. So the vulvar warts are not the most dangerous. They are warning that you could be having the other HPV, but there are a HPV family. Some cause warts, some cause the cancer. So the silent ones are the worst ones, in that unless you take care and get yourself screened, then you are likely to end up with cancer cervix. Now, if you get screened for high risk human papillomavirus and they are found to be present, then you have to be doing your pap smear very, very regularly indeed. Otherwise, the changes on the cervix will happen without you knowing that it is already changing towards cancer. If you do not have the high risk human papillomavirus, then you can afford to do your pap smear like every 3 or so years. But keep an eye, because if you have the type that causes warts, they are the same family as the type that causes cancer of the cervix.
Okay. I got pregnant with twins, but lost the pregnancy after 20 weeks. How long do I have to stay to conceive again?
There are a number of things to consider, but if we are just to talk about the physical aspect of it, the pregnancy state finishes at 6 weeks. So if you lose the pregnancy, then 6 weeks later, you're actually physically fit to get pregnant. However, the things to consider: are you psychologically fit yet? Are you in a position to run through with a pregnancy? Have you got enough counseling to help you run through with a pregnancy? And the fears that come with losses of a pregnancy. But physically speaking, after 6 weeks, you have finished with the pregnancy state, and you can become pregnant again.
Okay. I haven't had a period for 5 months, and I'm not pregnant. What could the issue be?
Now that one, I would need to know what your age is, or if you're using any sort of contraception, or if there is some major emotional happening that happened to you a few months back, because it could be that you are not ovulating because of age. It could be you're not ovulating because of a very major emotional hiccup, like if you lose a loved one, then you can lose your periods really with just like that. Or it could be that you're using something like the thing called Depo-Provera, which makes you lose your periods for a period of time. So I would need to know a bit more about that to be able to answer, to even start to hazard a guess. But like I always say on this platform, on this She Chooses to Live platform, we give you enough information to go and find out from your doctor. We tell you it is a problem, go and consult your doctor so that you can get the real answer. So even this one where you haven't had periods for 5 months, it is good to go and get yourself checked and find out why. But I don't have enough on that question to be able to answer more than that.
Okay. Does copper IUD cause recurrent yeast infections?
Copper IUD does not cause any infections at all. When somebody is wearing a coil, an IUD, intrauterine device, whether it is copper or non-copper, whatever it is, then the uterus has this foreign body that is inside it, and it is the way you'd have your hair fall into your eye, an eyebrow, an eyelash fall into your eye, and the way the eye tries to tear, to make tears to remove the lash. So the same thing happens to the uterus. If you've been inserted an IUD, then the uterus feels this something inside it, and it makes quite a bit of discharge, and during periods it makes quite a bit of period trying to sweep out that thing. The discharge should not be that it is infected. If it is infected, it has nothing to do with the coil. However, sometimes the coil does kind of keep some things, but not yeast, because yeast is always there with you. It doesn't need the coil to keep it there. It's always there with us. It flares when for some reason, or it is kept down for some reason, but it doesn't need the coil to flare it up at all. So no, the simple answer is that no, the copper coil does not cause recurrent yeast infections. It could cause quite a bit of extra discharge, which you might think is yeast, but it may not be yeast at all. It may just be that there is more discharge because of the coil.
Alright, so the next question is, what can I do to keep a healthy vagina?
Sorry, I didn't laugh. I would want to know what a healthy vagina is, because the vagina takes care of itself. It is what you shouldn't do that you should ask me. But don't do things to make the vagina healthy. The vagina is self-regulating. It has got very good bacteria in there called lactobacilli. It also makes some acid in there. So it keeps itself healthy. Just leave it alone. Don't try to make it healthy. It is healthy. The other thing you shouldn't do is you should allow the vagina to breathe. So don't have it blocked up all the time. So it's things you shouldn't do, not things you should do. Do nothing. In fact, just be natural and keep your vagina natural. It is self-cleaning. It is it keeps itself nicely acidified. Yeah. So don't do anything to make it healthy. Just avoid making it unhealthy.
Just on that question, some people would be of the opinion that you need to shower maybe 10 times in one day, or you need to frequently have sex to make sure that the vagina doesn't become dry or something like that. So what do you have to say about that? Because there are a lot of people who will tell you need at least you need to be sexually active, for example. If you're not taking baths at least 3 times in one day, then your vagina is going to... They come up with all sorts of things. So.
When you bathe your body, you do not bathe your vagina. The vagina is self-bathing. In fact, don't try to put a figure in there to do anything about cleaning the vagina. So you can bathe 10 times in a day, but just bathe the vulva. Leave the vagina totally alone. Just leave it alone. Whatever number of times you feel you need to bathe the rest of your body, bathe. Now, the issue about sexual intercourse and making the vagina wet, the vagina is not made wet by sexual intercourse. And there is actually nothing wrong about never having sexual intercourse. There is nothing that will go wrong with the vagina. If anything, it is when having sexual intercourse that things can go wrong, not abstaining. So no, the answer is that it's not sexual intercourse doesn't make the vagina any healthier. If anything, it introduces things that sometimes it shouldn't introduce. Having said that, I'm not saying sex is a bad thing. Sex is a very, very good thing. In fact, this week we have been talking about this Valentine. We've been talking about sex and how it should be enjoyed, completely enjoyed. And if it's not being enjoyed, there is something wrong. But it doesn't mean that you need sex. There is no need for sex to keep the vagina in any direction. No, you can abstain for life. You can abstain for many years. There is nothing will go wrong with your vagina. The wetness of the vagina comes from lubrication, from the cervix, from inside the uterus, from the cervix, from the walls of the vagina. And this will continue. In fact, every woman knows whether they are sexually active or not. But there is always a discharge coming out of their system. And that should be a natural thing that should keep going on. So no, don't bathe the vagina at all. In fact, that is one of the don'ts. And sexual intercourse has nothing to do with the health of the vagina.
Which foods are recommended for building blood levels in readiness for delivery?
Well, any foods that will give you iron are recommended. We are talking here about dark green foods, the kienyeji vegetables, those very, very dark green ones. We're talking about a bit of red meat here and there. So mainly green vegetables and red meat. Having said that, when you're pregnant, it's very unlikely that just food will be enough to keep your blood levels high enough. Two reasons. One, the baby also needs to take the iron to build their own blood. And the second reason is that when you're pregnant, the volume of the blood goes up by 30%. So whatever the amount of hemoglobin there was gets diluted. So it is usual that when somebody is pregnant, at some point we will need to supplement them with blood builders. But if you are to just consider the foods, then the very dark green vegetables, and we are talking eating quite a plenty amount, not a spoonful. We are talking eating quite a bit. And then the meat, but meat not a lot, a little bit of meat here and there. Those are the two main ones.
Right. I had a miscarriage, and at the same time I had fibroids. So I was washed, and to date I have not received my menses. This happened a year ago. What could the issue be?
Again, we need to know what age we are talking about, because a miscarriage should, I'm going to assume that we are talking that she got a miscarriage which did not complete, and she needed to be taken to theater for all the materials to be removed, to be cleaned. So it's very unlikely that just that would stop her having periods. We also know that when somebody has fibroids, they get fairly heavier periods. So one would need to know first of all, what age we are, what kind of I don't want to say what kind of cleaning happened, but what exactly went on in theatre that time, and mainly the age. There should be no reason why a year later, if you're not using any contraception and you're the right age, and your ovaries are still bringing out eggs, you should be able to be having a period. So I'm not able to answer that one directly. Please, again, consult your doctor and see what they can advise you. But yeah, that's abnormal. It is not a normal thing to lose a period for a whole year if you are in the reproductive age.
All right. is it possible that a pregnant woman can affect the DNA of her baby by having sex with another man?
No, that's not possible. That's not possible. The DNA of a baby is determined at fertilization. There is a sperm from the man who made you pregnant and your egg, and they meet and they make what is the person that is going to be, and that is their DNA. After fertilization, there is nothing else that is able to penetrate that baby, except things like infection. Infections can affect the baby and kill it or ruin it, but there is no other DNA that will be able to penetrate the baby. So yes, you can, even if you have sex with somebody else, the baby will come from, the DNA of the baby will be the original person who donated the sperm that fertilized the egg that made that baby. Yeah. We are finished.
Yeah.
I hope.
That is the end of the questions, actually.
Yeah. That's okay. That's good.
Yeah. So far, I'm not seeing any questions here. I can just see hellos. Hello. And that marks the end of the questions for today.
Yes. We will tell about the next time we do questions and answers, or the next time we do another session on something. But if you have questions, feel free to send the questions to us. We are more than willing to answer them. So because it's a Friday and it is February and it is the love month, buy and go and enjoy yourselves. Only be careful. Enjoy with being careful. All right.